Thank you very much. I'm really pleased to be able to talk with you today about what we've been doing at PLOS One to address these large-scale issues that you're hearing about. The work that I'm going to talk about today, I collaborated on with Emily Chanette, who's PLOS One's editor-in-chief. So a quick couple notes about PLOS One. It's a large open access multidisciplinary megajournal, and it has always been highly committed to upholding open science standards, high standards of scientific rigor and of ethics. The journal's published more than 300,000 articles since 2006. It works with more than 10,000 academic editors around the globe who lead the peer review for all of the research articles. And PLOS has had a dedicated publication ethics team since 2018. Now, while PLOS One is a very, very large journal, integrity has always been central to its publishing practices. We use multi-pronged approaches to screen all of our submissions for various integrity issues, employing a combination of manual checks, data analytics, and AI tools. And an important part of this is that a relatively small team of highly skilled staff conduct checks on every single submission that comes in. And with these approaches and PLOS One's high volume, we're able to rapidly identify patterns across submissions that can be indicative of these large-scale integrity issues. So when we detect such a pattern, we investigate, we respond as needed, we assess the portfolio-wide impacts, and we adapt our screening processes as needed. And so in this way, we continue to uphold the integrity of our content, and we also respond to emerging issues in the integrity realm. Now, over the last 5 years, we and others across the publishing industry have seen rises in these large-scale cases, the paper mills, the peer review integrity rings, authorship for sale. And this graph shows what we've seen at PLOS One during the time of 2021 to 25. You can see there's been a steady increase. And each of these cases represented on this graph may involve tens to hundreds of articles. Here I've broken down these mega cases by issue type and by discipline. The most prevalent issue type have been peer review integrity cases, followed closely by cases involving paper mill content or provenance issues. And in terms of scientific disciplines, we've seen these in all of the major areas in which PLOS One publishes, but the highest representation have been in the physical sciences and engineering. Here I'm showing the geographic origins, and this is based on the primary country of origin, based on author affiliations. The highest representation here have been from China, Pakistan, and India, but there's also a large group here at the bottom of the graph where the author groups are multinational. So for any given article, there are multiple countries represented. And while we have these concentrations at the bottom of this graph, I just want to mention all of the things at the top of the graph that really show that this is not a geographically isolated issue, and we're seeing them from all over the place. Now, we've taken several approaches to combat these types of issues, continuing to build on our strong foundation of pre-publication screening and robust editorial policies that were in place long before 2021. And given the journal's large volume, we focus on approaches that can be applied systematically at scale, that require relatively little time per manuscript, and that address specific yet wide impact issues that we've encountered in our publication ethics cases and in our submissions. And on this slide, I've highlighted several of the types of things that we have done over the last couple of years. And you can see they include policy updates or new policies, updates to our submission screening checks, the introduction of audits, and the introduction of AI facilitated screening for paper mill content. And another important aspect of this is upholding our editorial board integrity. And so we have also made a number of enhancements to the stringency with which we vet our editorial board members. So what have we seen in response? Here you can see how the different interventions have impacted our desk rejection rates. And the desk reject rate will reflect not only the content that is submitted to PLOS One, but also our ability to detect problematic content when it comes through. And each of the interventions has had a pronounced effect on the desk reject rate. And over time, over the last few years, these and other changes that we have made have helped contribute to a change in the desk reject rate from 13% in 2021 to 40% in 2025. Now, not all of the integrity issues that we see stem from paper mills or fraudulent activity or misconduct. There are also a number of issues that we see that are stemmed in scientific issues to do with poor study design, poor research questions, scientific rigor type issues. And in response to concerning submission trends, PLOS One implemented enhanced pre-review scientific checks for specific study types in 2024 and 2025. And for these, we applied criteria that were developed in collaboration with the academic community. And they focus largely on research questions, study design, and reporting type issues. PLOS One applied this approach to Mendelian randomization studies, to systematic reviews and meta-analyses, and more recently to retrospective studies that rely on public health databases. And as you can see here, this has had a really profound effect on the desk reject rate for these study types. Now, we've been devoting a lot of resources, and we continue to devote a lot of resources to these types of preventive integrity efforts. Given the rise in paper mills and the magnitude of the impacts that they can have, it's really important that we try as much as possible to address these before publication. As you can imagine, it takes a lot less time and resource to reject 100 articles than to investigate and retract 100 articles. And every single one that gets to publication has the potential to impact ongoing research and the wider community. So here I'm showing a metric that is a rough measure of our performance in this area, which shows the ratio of the pre-publication versus post-publication impacts of megacases detected in a given year. And what you can see here is that we've seen a substantial improvement between 2022 and 2024. And just to put this into more tangible numbers, in 2024, the journal rejected more than 3,000 submissions that were flagged for potential paper mill concerns, and the post-publication impacts of those mega cases were really very low. So this is ongoing work. We're continuing to adapt. We're continuing to, keep high alert be on alert for new emerging integrity issues. We're keeping an eye out for tools that come onto the scene that may help to support our work in this area, and continuing to work with others across the publishing industry on efforts to help address these types of issues at a group level. And with that, I will stop. Thank you for your attention. I'm happy to take any questions.
Maria Kowalczuk, Research Integrity Manager at Frontiers. Thank you, Renee. Very interesting presentation, especially as Frontiers is also an open access publisher, so we see a lot of very similar issues. And I was wondering whether you tried to assess your rejections, like any possibly false rejections that you may have been too strict in rejecting potential paper mills, whether you have tried to assess that kind of false rejection rate that you may have introduced?
Yeah, thank you for the question. So we haven't taken a directed approach towards looking at false rejection rates. What we have done is watch for appeals, and we have seen very few appeals to rejections that were based on potential manipulation of the publication process concerns. That may or may not be an indicator, but that's what we have seen.
Johnny Anidis from Stanford. Very, very interesting presentation. I'm interested whether you have published the criteria for the methodological bulk rejections, because I just looking at the numbers, 85 to 89% desk rejection for what are supposedly the most rigorous designs. Mendelian randomization studies are more rigorous than other epidemiological associations. They're supposed to be an improvement. Systematic reviews are supposed to be the highest level of evidence, traditionally. I do worry whether fields designs that care more and therefore they're more rigid and demanding in terms of their standards may have very high desk rejection rates, while others that are far worse, simply you don't have such a checklist, and therefore the rejection rate at the desk stage might be much, much less, even though they're horrible compared to those.
Yeah, thank you for the comments and the question. So have we published the criteria? No. They are in place, they're in use, but we haven't published them. And I think it is, like I said, those particular study types were selected for this approach because we saw concerning spikes in submissions coupled with poor submission quality. And we wanted to make sure that we were holding high submission quality standards. I think it is possible that if you were to take, another group of articles in a completely different field or a different study type, I think you could apply similar approaches potentially. But I think these, like you said, these types of studies, at least there are some community standards around kind of the minimal standard for methodology and rigor, which we've been able to apply. So I think we've been happy to see the rejection rate in terms of showing that as an indicator that the higher quality articles are the ones that we're publishing. Yeah, but it's an interesting point and well taken. Thank you.
Thank you.
Thank you. While I have the mic, I'm going to ask two virtual questions. June Oshiro from Scientific Publications at Mayo Clinic asks, when you issue a desk rejection, do you specify the reason, for example, paper mill involvement, in your letter to the author? You just reject?
So in those rejection letters, they will typically refer to concerns about potential manipulation of the publication process. So we're not saying you're from a paper mill, but we're saying we have concerns about this. And we have a policy on manipulation of the publication process that supports us in rejecting or retracting based on such concerns. So.
Makes sense. Thanks.
Mm-hmm.
And then Rachel Claus from Royal Roads University in British Columbia says, great presentation. Curious about whether PLOS One applies any specific criteria to evaluate research questions and what kinds of issues are observed there that result in rejection.
With regards to the research questions themselves?
That's the question.
That's what it's getting at?
Yeah.
So there are certain criteria that our team will apply, and I won't be able to mention all of them, but I'll mention one, which refers, it's partly research question and it's partly redundancy, which is that the question of, has a similar research question, taking a systematic review as an example, is there a systematic review published within the last 1 year, 3 years, addressing the same or similar research question? So is this advancing the field? Might be is one example. And then there are some other issues around kind of the specificity and the sort of crux of the question.
Thank you.
Sure.
Steve Finn, Chairman Network. One of the, I guess, lessons I've taken from today's presentations is how, the important role of editors in sort of trying to be alert and understand the potential for all of the problems that have been described. With thousands of editors, how do you, and who in general presumably only manage a few papers a year, how do you maintain the adequate knowledge and training for your editors?
Thank you. It's a really great question and an important one because we do rely on the editorial boards to manage the peer review. And so how are we supporting them and also evaluating their work? We have large group at PLOS that's devoted to editorial board management that carefully vets all of the editors on the board when they apply. We also have work underway to help improve our ability to detect issues with peer review integrity. And we will offboard people if there are integrity concerns. But there are overall, we also have provided some webinars and such, some communications resources to our board, but it's definitely an area where there's always an opportunity to do more, just to make sure that we can sustain that as a really robust and reliable network of people with whom we're working. Thank you.
Hi, Fred Barker from Journal of Neurosurgery. Having written one of the first meta-analyses in neurosurgery, I've been tasked ever since with reviewing them. And I've reviewed about 600 meta-analyses in our field. And the majority of them are profoundly flawed, really profoundly flawed, right from the data extraction process all the way through, not understanding the difference between facial numbness and facial weakness, for one example. I'm curious whether your three examples, Mendelian randomization, meta-analysis, and retrospective analysis of administrative data sets, were chosen because of the common denominator that unskilled practitioners can have access to large bodies of data that they did not generate themselves.
So I can say that definitely the potential impact of these types of studies on the community play a role. You know, taking meta-analyses as an example, they're gathering data and people may look at the results of those and change their practice in the clinic, for example, on the basis of that. So the potential impacts and the way in which the data are used, it's definitely important. When those article types were selected, it was based on, the selection was based initially on other triggers, but those triggers combined with the potential impacts and the importance of those types of studies together led to decisions around prioritizing them.